Let's get 2 minutes on the clock and your time starts now. All right, so time is up, and sometimes these questions come along that you feel like they're almost throwaway questions. They seem a little bit too easy. I'm not trying to trick you up tonight. Every now and then you will get some easy ones thrown your way, and of course here we've got a wide range of differentials you could be kind of going into. I think though we want to look at that qualifier there in terms of what is the most likely diagnosis for ROSA. So with sudden onset of kind of acute pain, the things you'd be wanting to really kind of rule out and are the most likely in this setting would be things like deep venous thrombosis of the right leg or calf. I think either way, if you specify that, you're going to get 2 marks there. Now again, we are being specific and concise, and so we want to be specifying this is of the right leg / calf, whatever you want to put in there. If you're just putting in deep venous thrombosis, you're going to be missing out on potential marks. Likewise, if you just put DVT, you're again using an abbreviation as we've gone through, you're going to miss out on marks there. So again, avoid all abbreviations. Hopefully I'm really ramming that home. Sorry if I'm driving you crazy with it. Now, of course, there's also these other reports here of this bit of fatigue more than usual, no other specific symptoms. This should raise some red flags for things like a pathological fracture of the leg or calf. And again, if we're being right leg or calf, being specific there, you'd be getting 4 marks. Otherwise, the less specific you are, you're going to be potentially losing out on marks. And of course, this is most likely diagnosis. You'd be thinking about things like acute cellulitis of the right leg or calf. Now, with these vague non-specific things, you would also consider things like compartment syndrome of the right leg or calf. In here, I think there's a few too many red flags to say simple musculoskeletal, there's no preceding trauma, and so I don't think you would actually be getting any marks by putting that one in the differential list here. All right. Of course, we have more questions to go through. Let's get another 2 minutes up on the clock, and your time starts now. All right, time is up, and of course, the people watching and waiting may have noticed. Yeah, I mucked up the units of measurement. Sorry, but we know a hemoglobin of 90 is definitely on the lower side. Apologies for that. Now, of course, this does take this case towards a slightly more kind of sinister turn, and with this, we should really be starting to think of malignant causes, and in this case, really, it's trying to lead you down a situation of lytic lesions with myeloma being one of the leading culprits here. So for this, you'd be ordering a SPEP, serum protein electrophoresis, X-ray or CT skeletal survey. Now, with that, I think you would get full marks either way, but I do want to point out this is set in a rural general practice, and so taking that into consideration, not every rural town has ready access to a CT scanner, which is why I think getting the X-ray marks in there would definitely be valid. Certainly, kind of gold standard would be CT skeletal survey, and it is likely that that would be available in some way, shape, or form. And certainly, the question does specify what investigations would confirm the diagnosis, and so that would be where we'd go. More on that in a moment. Of course, we would be looking for a bone marrow aspirate and biopsy, and this would likely require referral to somewhere else to have it performed. Again, this is what would confirm the diagnosis for Rosa, and so that's going to be kind of on that list still. Now, the positron emission tomography, for this one, I have marked it down there as a little bit of a risky answer. The reason for that being, yes, it would be diagnostic, but it's usually not done first instance. This is usually done as a follow-up thing to track either progress, complete staging, or to check response to treatment. So again, if we're saying to confirm the diagnosis, I don't know if this would necessarily be put out as a first line kind of thing there. Hopefully that makes sense. Now, the thing with the PET scan is it is more sensitive than conventional skeletal survey for detection of osteolytic lesions. We do have the options as well, things like serum or urine immunofixation. So that's identifying paraprotein immunoglobulin types and should be considered as well negative in patients that have non-secretory multiple myeloma. And so you may actually miss a few diagnoses there, but certainly would be part of a workup. So lots of things to keep in mind there, and hopefully you've managed to get a few of those down. Of course, we have another question. Of course we do. Let's put 2 minutes back on the clock, and your time starts now. All right, time is up, and you will find questions like this from time to time where it's checking some of those softer skills, those communication skills that go along with day-to-day general practice. Now, as part of the curriculum in the 2016 curriculum guide, they do mention they love the spikes mnemonic. It is also mentioned in the 2022 revision curriculum, but not as specifically stated, more points towards articles that spell out the mnemonic. And so this type of question is something I have seen before in actual exams. I obviously can't say what the exact question was, but suffice to say, I would never be surprised to see this in an exam as well. This is also something that we do day to day, and so even if you're not sure of any particular mnemonic or thing that they would be looking for, having a bit of a common sense approach, I think, would still score you reasonable marks. Now, the spikes mnemonic is, of course, S for setting the scene, or some kind of equivalent kind of answer in that form, guiding to that statement. Perception, so establish the patient perception or knowledge base from which to build upon. Would be another mark. The invitation, I for invitation, to explore what the patient wishes to know or equivalent. Knowledge transfer, so direct and simple knowledge transfer using non-jargon and making sure the patient understands the information as it's given. And to recognise or empathise, E for empathise with the patient emotions. Multiple mnemonics will kind of flick between empathise and emotions, again, as long as you're having something in there. And of course, summarise the consultation or have that strategy for moving forward. So something to say, this is where we're at, this is where we need to be, and this is how we're going to get there. Hopefully, something you've seen, heard, and practiced before. Hopefully it's not something you've had to practice because it's a horrible thing to have to go through, I'm very sorry, but it is a handy skill to keep in your GP toolkit